Well, hello there, and welcome to this webinar, Foods That Fight Pain. My name is Emil Tompkins. I am a chiropractor in Northwest Tucson, and over the last 10 years, we have been taking care of thousands of families, and working on not only helping our patients get pain-free, but also making a drastic difference in their lives, their health in the long run, and hopefully. This webinar, the information that we're giving you here, is going to be a part of helping you to be as healthy as you can possibly be. So we're just going to go ahead and dive in. The reason there's so many reasons why I personally am giving this webinar and why I've had to research the information we're covering here today. A lot of that has to do with my family. And here's a picture of my four beautiful children, and we're going to talk about specifically today the young lady on the right. Her name is Hannah. Hannah's 8 years old, and she is full of energy, full of life, full of entertainment. Just the other couple of weeks ago, we had a football game, and here she is getting ready to get the ball.
Run, Hannah! Run, Hannah! All the way, Hannah!
So my little girl is we didn't know it, but she's a little athlete. So along with being our source of comic relief and family entertainment, and every once in a while our source of stress, we found out that she's very athletic, and it was really neat to be able to watch her and all my kids play football this year. But one thing that the reason why we're talking about this today is because there was a time that we didn't even know if we would make it this far. Here's a picture of her as a baby, and when Hannah was born, she was born addicted to methamphetamine and cocaine. And when she was born, she was dealing with lots and lots of health problems, and had been in and out of the hospitals the first year of her life. The majority of that was in the hospital or intensive care. And it had been narrowed down. It took a while to get it figured out. It had been narrowed down to an issue with some of the foods that she was eating and the way that her body was responding to it. When she was little and taking in formula, she would aspirate it. It would get into her lungs, and then her lungs would send T cells. Her body would send inflammatory immune cells trying to kill the wheat that's in that formula, and it developed a cellular immune response in her body to that wheat. Her food was creating inflammation. Now in her, this wasn't necessarily causing pain, but it was causing so much inflammation that would affect her lungs and her breathing, her GI tract, and after lots and lots of searching for an answer, the most effective thing that we were able to do for her was change her diet. And that's what we're going to be talking about today. How our food can be more powerful than any medicine that we can take. So as we move forward here, just a question that I want you to ask yourself. Just think about this. What is your favorite food? Take a moment, just think about that. What is one food that you think you might not be able to live without? We'll think about what is your favorite food. Now, we're going through this because most people at some point in their lives deal with some kind of pain. Once we hit about 30, some part of our body has caused us pain at one point or another. And there's a certain amount of that pain. Some of it could be due to mechanical issues. Some of it can be due to major injuries. Some of that pain is simply due to the things that we eat. But the problems that we're dealing with a lot of times is more than just pain. That inflammation affects the entire body in different ways. In the rare example, my daughter Hannah, that food was creating inflammation in the area of her lungs. For some people, that inflammation can affect our heart, our digestive system. Actually, we'll talk about that. Arthritis, asthma, allergies, other inflammatory conditions. If you're dealing with those, if you know someone who's dealing with those, then you can have an impact on changing your health and potentially theirs as well. Now, this overtime inflammation, and when we think about inflammation, think about If you have an injury, let's say you're playing basketball and you twist your ankle, and that ankle will swell, and that swelling happens. It hurts really bad, but your body is sending cells that are designed to heal that area, so that over time, eventually, that ankle heals. We feel better. That is acute inflammation. That is actually a good thing, a very good thing. The problem is that that inflammation over time, or if it's left unchecked, or if it just continues to happen based on the things that we put in our bodies, that can lead to these major inflammatory degenerative condition. Heart disease, cancers, certain kinds of arthritis, Alzheimer's are affected by inflammation. So this is more, so much more than just pain. Now here's some of the risk factors for inflammation. Smoking, excessive weight, not exercising enough, stress, unprotected sun exposure, hormone replacement therapy, certain diseases, our diet can be a risk factor for inflammation. And that's the one that we're going to talk about mostly today. So, what are our options? We can take medications if we have this issue with inflammation, but we know these medications have side effects. There are certain medications, NSAIDs, non-steroidal anti-inflammatory drugs, like Advil, ibuprofen, naproxen, Aleve, those kinds of things. But the side effects are so significant that most of us don't want to do that, especially don't want to do that for the rest of our lives. Another option, a much simpler option, well, actually, let's go back a little bit. Surgery. You leave this inflammation unchecked over time, it will create issues that will then require surgery. So we don't want that as an option. But the last option that we'll talk about mostly today is simply changing our diet. Simple food changes can make a huge difference in the inflammation levels that we're experiencing. And so that's what we're going to discuss today. There's a lot of different resources that we get our inflammation material from. There's a number of different books, and one is called the Anti-Inflammatory Diet by Monica Reinagel. Real good book. Real good book that provides lots of information regarding inflammatory products that are found in the food, and then anti-inflammatory products that are found in food as well. So here's a couple of natural items that will reduce the level of inflammation that we have. Fish oil, aromatic spices, anti-inflammatory plants, stinging nettle, ginkgo biloba, some other foods, turmeric, ginger, chili peppers, pineapple, and it's actually not just the pineapple, but there's a component inside pineapple called bromelain that's a very powerful anti-inflammatory. However, you need a lot of bromelain to have these effects. So you almost couldn't just eat pineapple and get the right amount of bromelain. You'd need to supplement with that, but that makes a change in pain. Now we're going to go over some more foods in a minute, but how do we know that foods actually have these anti-inflammatory properties? Well, those different properties have been studied, so we've been able to identify certain chemicals, certain components in food that make a difference in the inflammation that it can cause or prevent. So the type of fat will affect our inflammation. The type of fatty acids like omega-3, omega-6, omega-9 fatty acids. Antioxidants, antioxidant levels can affect our inflammation. And then sugar. So we'll talk about each of those things, and when you put them together, that will calculate an IF rating. So the inflammation rating is just a number that, based on the kinds of components inside the food, you'll get a certain number that tells us how much inflammation can be caused or prevented by that particular food. So first, the type of fat. Let's talk about that. Monounsaturated fat is a fat that's liquid at room temperature. It's solid at cold temperatures. Things like avocado, olives, olive oil, those things are associated with reduced inflammation. And for years now, we've been talking about, everyone's been talking about olive oil and the benefits of that. So that might not be much of a surprise for you. Another one that might not be much of a surprise, trans fatty acids, fats that have been chemically altered by heat or hydrogenation. Fried foods, shortening, margarine, packaged foods, those kinds of foods are highly inflammatory. They will lower the IF rating. Now, this IF rating, that number that we're talking about, if your food has an IF rating of 0, then it doesn't contribute anything to inflammation, positive or negative. If the IF rating has a positive number, and the larger the number it is, the more it will help reduce inflammation. If the food has a negative number, the more it causes inflammation. So we always want to stay in the positive if we can. EPA is found in fish and seafood. It produces anti-inflammatory chemicals. Actually, it's a strong anti-inflammatory. So fish oil, the EPA found in fish oil. DHA is also a polyunsaturated fat. It's in the omega-3 family. It's something that helps reduce inflammation, but what's interesting is that it helps reduce inflammation in the brain. So it's found in seafood, produces anti-inflammatory chemicals, strongly, strongly anti-inflammatory. Now, sugar. Foods with high levels of sugar or a higher glycemic index are pro-inflammatory. Here's another thing. Wheat and any products made with wheat are also pro-inflammatory. And this is where a lot of times I might differ with some of the things that are found. Excuse me, with some of the things that are found in that book, The Inflammation Factor. Wheat has so many negative effects on the body that simply the fact that it affects your slightly your IF rating, it's worse than that. Sometimes it's recommended that you still eat fish, and actually we want to stay away from that as much as we possibly can. Antioxidants found in many fruits are very anti-inflammatory, so or are mildly anti-inflammatory. And one of the reasons why they're not highly anti-inflammatory is because of the sugar content. The sugar starts to increase inflammation, but the antioxidants will decrease inflammation. So we talked about the IF rating. You want a number that's as high as possible. At the minimum, you want a positive number. So let's think about that. Some examples here. Hang out for just a moment. Let's see. So examples of food. I'm just going to go through a list here. We have raw pecans. If you were to eat a 1/4 cup of raw pecans, that has an IF rating of 53. So an IF rating of 53 is anti-inflammatory. So nuts are something that would be anti-inflammatory. But now we're going to go to something like a pie crust. A pie crust, if you were to eat a pie with crust, that number, and not a whole pie, but let's say a piece of pie that's 1/8 of a pie crust, the crust all by itself has a negative 76 number. So it just shows how a couple of simple things, a nut compared to pie crust, can have an effect on our inflammatory levels. So that negative 76 number is very, very inflammatory. That can cause pain over time. So let's talk about this. A couple of things that might be slightly surprising. We have beans. Beans are something that is found to be actually, beans themselves are just mildly inflammatory. And sometimes this is surprising because we think beans are a health food, and they are relatively healthy, but it's more the kind of fat that's inside them that can make them slightly inflammatory. Another thing here, pork and beef, and this might be a bit of a surprise, but lean cuts of pork and beef are very good choices. Red meat is frequently portrayed as a dietary villain, usually because of its saturated fat content, but because it contains an equal or greater amount of hard healthy fats, then it's slightly anti-inflammatory. Because it's also a good source of folic acid, B12, selenium, and zinc, these antioxidants also are something that help to reduce pain. Another thought that might be surprising, leaner meat is not always better. For many types of meats, leaner cuts rank higher in the in the IF ratings, but actually, there are certain things like when it comes to certain kinds of beef, like a T-bone steak, the fat around it is actually has a lot of anti-inflammatory components. So if you trim the fat, you actually miss out on some of those anti-inflammatory components. So every once in a while, and you can, if you were to purchase that book, or I'll also give you an opportunity to download the notes that we have here. That will help give you more information on this. Anyway, leaner is not always better. The next step here, dairy. Dairy is inflammatory. Dairy is definitely inflammatory, but what's interesting is low-fat dairy is less inflammatory than higher fat choices. Chicken and eggs, actually, chicken and eggs are inflammatory. We've been told that chicken and turkey are more healthy, but unfortunately, what's in it, it's fairly low in fat, but the only thing that contributes to the inflammation in chicken is their fat, and the kind of fat that's in there is the pro-inflammatory type of fat. So it's actually healthier not to eat as much chicken, at least when it comes to inflammatory levels. Now, one of the biggest all-stars we have in the inflammation fight, cold water fish. If you followed health trends, this might not be much of a surprise to you, but fatty fish, salmon, mackerel, tuna, herring, sardines are well known for being terrific sources of omega-3 fatty acids, and those omega-3 fatty acids are very, very anti-inflammatory. But what might be a surprise to you is that farmed salmon actually has such a negative effect on inflammation. It's one of the worst foods for you because salmon, cold water salmon, usually eats algae and other fish, those sources of omega-3s. Farm salmon, unfortunately, farm salmon eat corn and other grains, making their fat content completely shift over into the inflammatory arena. So let's talk about some of the best foods that are in each category. When we think about spices and those sorts of things, chili peppers is by far our biggest anti-inflammatory agent at 50,000. Garlic powder at 31,000, cayenne pepper at 28,000. Again, anything over 0 is anti-inflammatory. These guys are really high. Ginger at 27,000, turmeric at 22,000. Very highly anti-inflammatory spices. Now for fish and seafood, mackerel at 1957, anchovies at 1024, Atlantic salmon at 907, tuna at 546, oysters at 533. Now, vegetables, parsley, by far our best at 502, chives at 378, pumpkin at 334, onions at 303, collard greens at 273, and then spinach at 259. Those are some of our very effective anti-inflammatory vegetables. Now for nuts and seeds, flaxseed is very good at 490, macadamia nuts 481, chia seeds at 270, almonds at 200, and walnuts at 158. Now poultry, goose at 72, turkey at 68, chicken broilers or fryers, and this isn't necessarily the boneless, skinless type, because you need the right kinds of fats to be anti-inflammatory. So the chicken broilers or fryers are at 26. So poultry is not as big of an anti-inflammatory agent as one would have thought. Dairy, the only thing under the dairy list that really is anti-inflammatory is egg white powder or other kinds of egg white or egg white substitutes are the only thing that's listed under dairy. Fats and oils. Fish oil, salmon, 13,892. There's other types of fish oil that also have anti-inflammatory properties, but the ones made of salmon are the best. Sunflower oil at 723, hazelnut oil at 623, olive oil at 526. Now here's some anti-inflammatory fruits. Acerola 696, olives at 87, avocados at 79, pineapples at 36, and papaya at 21. So as you think about how your favorites are stacking up, just think about the things that you like to eat during your day. Are the things that you enjoy eating on this list? And if they're not, we may want to start adding those to the things that we are eating. If you do that, you'll see changes in your pain. So you might be asking, how do I create meals? And so this is what you do. You first you need some kind of chart or way to calculate your inflammatory ratings. If you have a smartphone, there's an app called IF Tracker, and I get no I get no compensation or anything for recommending certain things. The IF Tracker is one way, probably the simplest way, to be able to track inflammatory levels. So if you go to your, whether it's your iPhone or Android phone store, and look up IF Tracker, you can enter the food that you're eating and it will calculate the inflammatory rating of that food. And then as you're going through the day, it'll tell you if you're on the positive side or on the negative side, so you know where you're at. So you just have a combination of different foods that will keep that IF rating as high as possible. Now, as far as where we go from here, I'm going to have attached to this webinar a spot that you'll be able to click, and actually if you look below, it'll be right there, for you to complete the inflammation questionnaire. That inflammation questionnaire is going to begin to tell you if what you need is something that's more of a maintenance type of schedule, or more of an acute get out of pain schedule. As a general rule, if you're healthy and you don't have any of the risk factors, you just want to set up a program that keeps you in an IF rating of 50 or more, which means you can eat certain foods that might be slightly pro-inflammatory, as long as you're eating enough things that are anti-inflammatory. But if you really need some major inflammation relief, like you're already dealing with pain, or you already have one of these degenerative diseases, then you're going to want to maintain an IF rating of 200 or more for inflammation relief. Now, let's say you're thinking, okay, I want to do something, I want to make a change, but I'm not sure exactly, how I'm going to start moving forward and making a difference in the things that I'm eating, or I just don't know where even to begin with what I eat. And here's something that I'll recommend. There's a specific kind of cleanse or detoxification that involves a few different steps. One of those steps is an elimination diet, completely eliminating some of the things in our diet that can be pro-inflammatory, and really sticking with the foods that are anti-inflammatory. Some of the foods that our body might be sensitive to, we get rid of those and keep only the things that our body generally can handle really well. And doing this cleanse kind of forces us into that healthy eating to start. And during that time, you're also taking a specific supplement that's designed to eliminate toxins from the body, eliminate toxic substances from the body. Now, this isn't a digestive cleanse where you take the cleanse and you're in the bathroom, but it's something that activates your liver and kidneys so that they function as well as they possibly can. And as we do that, we start to, one, we get rid of toxins. Two, we've changed our diet in a way that will be anti-inflammatory. We'll start to feel better. People with some serious neurological pain-related issues like fibromyalgia have responded really well to this particular type of cleanse. It's called the Clear Change Program through Metagenics. And what's appearing down below here in a moment is a link for you to be able to click there so that you can order that cleanse. That is something that will make a difference in this journey towards reducing inflammation. Now, and if you follow the meal plans, the steps that are there, you will be eating primarily anti-inflammatory foods. Your IF rating, if you stay in that chart, will always stay in that anti-inflammatory range, which is the key. So if you want to experience that, go ahead and click on the link below for the cleanse. You'll get more information on that cleanse on our online store, and you'll certainly you'll certainly be able to order that. Now, you may have a question: can I do more? Can I make more of a difference in what I'm feeling? Or maybe I have been doing a good job with my eating, and I feel like I need to do something else when it comes to our pain. One thing that we're so committed to in our offices is being committed to not only making a difference in our patient's pain, but to make sure that we're following all the steps to becoming as healthy as we can be. And one of the first things that I'd recommend is a full, complete, thorough chiropractic evaluation where we analyze how exactly our spine and our nervous system are functioning. We talk about our nutrition and our diet. We talk about physical stress that can be creating some of our problems, and strategies to be able to improve that with certain types of exercises or something. If we have major mechanical shifting in the spine, we've got to be able to correct that, because those nerves send abnormal pain signals to different areas as well. We've got to make sure that things are absolutely functioning as well as they can. In our office, we offer a complete exam and X-rays. Everything we do as far as our evaluation procedures is normally $225. We're offering that for anyone that is listening to this webinar for only $27. So instead of $225, you can order it for $27. It's an amazing offer for anyone that is a part of this webinar. Guys, it's so important to make sure that we're doing everything that we can to achieve the kind of health that we want. Sometimes we sit back and we feel like I want to be healthier, I want to make changes, but the changes that we're talking about making can be difficult, or these changes that we're talking about making can be painful. Like, it can be painful to stop eating wheat, or it can be painful to stop eating candy. It can be painful to begin an exercise program. And even though some of those things can seem and feel painful, even be painful, think about the pain that you might experience from making changes in your health to the pain that you're definitely going to experience if you don't. What do you choose? What would you like to see your health do in the future? This is what we're working on here, is making sure that we are going the positive direction in our health. We can deal with some of the pain of a change in an activity if that means we don't have to deal with the pain of a lifetime of hurting, a lifetime of poor health, and maybe a shortened lifetime because of that poor health. You have the ability to achieve amazing health. We just have to follow the steps to get our body functioning the way that it should. I'm so looking forward to making a difference in your health. If you have any questions, you can always call my office at 520-572-2596. Even if you aren't in our area of the country here in Northwest Tucson, Southern Arizona, I would always be willing to answer any questions you might have, and even direct you to someone who can help move you in the right direction in your area. I want to thank you so much for being here. Thank you so much for being a part of this webinar, and I look forward to helping you achieve your health goals. I'm Dr. Emil Tompkins, and I hope you have a great and healthy day.